The main topics I'm going to cover are supplemental security income, which I have a hard time saying because I always just say SSI. SSI is a payment program for low-income people and disabled people who can't make money themselves. So it's actual money coming to you if you're disabled monthly, and the amount depends on if you're a family or single, and I'll have a slide that explains the amount. It's one of the principal means that our people support themselves. It's very important. The other reason it's so important is if you qualify for SSI, thanks, okay, here we go. That's it. It's my first slide. If you qualify for SSI, let's see if I can get this laser, see? This is SSI. You automatically qualify for Mass Health. Beautiful. So then you don't have to do the whole Mass Health application. So that's a very handy thing. And what we try to advise our clients is to go ahead and apply for SSI when you're 18. Why 18? Before 18, your parents' income counts as your income. So some people might get it before 18, most don't. So when you turn 18, you're considered emancipated by Massachusetts, and you are poor unless you somehow save money. So another good reason to apply when you're 18 is you don't have any work history. So you're more likely to get it. Now, if you do have money when you're 18, you need to spend it down. So find a way to spend it. ABLE Act now. ABLE Act is not yet in effect, but it will be by the end of the year. It's a 529 college savings plan for our kids. It's not for college, for other reasons, but it's tax-free, and you can put it into an ABLE Act, and it will not be counted by Social Security. I'm going to get back to that later. But the point I'm making is that in order to get SSI, and let's talk about SSI. Okay, it's an income support program. It gives you money, cash. Here's the amount it gives you. If you're living alone, $847 a month. If you're living with your parents, $576 a month. Everybody always wants to know, how much money is it? Well, that's how much money it is, tax-free. Needs-based, you cannot have, well, let's see my next slide. Okay, let's start with how do you get SSI, medically speaking. You have to be disabled, okay? You have to prove you're disabled. So with my clients who have autism, I don't have to go into this very much, right? But with you guys, this is a little bit more difficult. The question is, can they be substantially employed? This doesn't mean they can't work at all, but can they really make a living enough to support themselves? Okay, so how do you show you're disabled? You have borderline or whatever. Either you can meet a listing, or if you don't meet the listing, you can show that otherwise you're unable to work, a little harder. But the first thing is if you can meet a listing. There is no specific listing for borderline personality disorder in the Blue Book, but there is a listing for mental disorder, and that's what you would fall under. So in order to meet the listing, I have it in the slides, there's some definite, specific criteria. The presence of deeply ingrained inability to adapt, characterized by, and there's these things that are an or, not an and. You don't have to prove all of these things. The desire to be secluded, inappropriate suspiciousness or hostility, odd thoughts, perceptions, speech, and behavior, persistent mood disturbances, or intense and unstable relationships with impulsive and damaging behaviors. Okay, then you have to show that you have one of those and it restricts your activities of daily living, that disrupts your ability to function, difficulty with social functioning to the point where it disrupts your ability to interact with others, difficulties with concentration that affect your ability to complete tasks, or repeated episodes of decompensation. So again, we're really trying to prove we can't work, and for what, So this is the medical evidence. I'm not going to go through it, but it's an involved process. SSI is a big deal. You're going to have to spend some time on this. And yes, decompensation, well.
I don't know what that word means.
Yeah, falling apart.
Okay.
You just can't work. You just fall, somebody asks you something and you just lose it. Okay, medical evidence involved. You have to have doctor's evidence. You can't just go in there and say you can't work. Now, let's say you don't meet a listing, then you have to show you're unable to work, and they have this thing Social Security calls a mental residual functioning capacity assessment. So they assess you. And what I don't understand your disorder too well, but what I understand, and I've been told, is the lack of control of emotions and tendency towards anger that cannot be controlled is probably the biggest obstacles for borderline personality disorder people getting and maintaining a job. So that would be your evidence if that's what you have. Okay, now let's say you've been able to prove that you're not able to be substantially gainfully employed. Now you also have to prove that you have financial eligibility. That means you don't have any money. So you can have no more than $2,000 in assets. That's a very low number. You can't have savings bonds. You can't have any kind of cash or savings accounts that add up to more than $2,000. This is what I do for a living. I make special needs trusts for people because it's not counted. It's not their money. So they can have, what we do is we create trusts that allow the person to have that money, but it's not their money because the trustee controls how it's used. So you have somebody you trust to be a trustee, maybe yourself, maybe your sister, whatever, that you put them in charge of divvying out the money. It's not counted. The only reason it is counted is if you use it towards food or shelter. If you use that money from the trust towards food or shelter, it decreases that SSI payment by the amount that you paid for that, up to a certain amount. It's only 1/3. There's a cap on that. But other than that, you can use the money from the trust however you want. Now, what I do, I tend to make special needs trusts for part of the will, part of the estate of the parent, and it's not funded until they die. Okay? So while they're alive, they divvy out the money when they want to help their kid, and it doesn't have to be in a trust. You don't have to get a tax ID number. You don't have to worry about it. But then when they're gone, they need somebody else to do that, and it's not counted. Okay? So that's a principal thing for all your estate plans. The other thing it does is it makes sure that you have somebody watching that money. It doesn't go to them directly if they need some help with that. But there's also special needs trusts that are funded while you're still alive and while the person's alive, if you need to do that. There are reasons why sometimes you need to fund them while you're still alive, but we'll get into that later. Yes?
I don't know if this.
So SSDI, you guys, is completely different from SSI in terms of everything other than the medical criteria. You still have to prove that you're disabled to get SSDI. Okay, but other than that, it's insurance. You don't have to show that you have no money, that you don't have $2,000, and it's easier. So SSDI is something that your kids can get when you retire or you file and suspend. When you die, okay, then they get SSDI, and it can be more than SSI. It can be less, and SSI will make up the difference. SSI is not going to pay both, so if it's up to $847, you're not going to get more from SSI. Because both of them are Social Security. That's the other thing they have in common. They're both Social Security Administration. They both have the same medical criteria. But other than that, they're very different. They depend on how much you and your husband paid in to the system. And in time, some of our kids actually are themselves pay in the system and can collect SSDI themselves, which is handy for other reasons other than the money that I'll get into. Okay? So let me talk about the offsets. I got into that briefly. When I said, that's the second one, when I said in-kind food or shelter is an offset. The other offset is if you work. Now, a lot of your kids probably, or you work, right, a little bit. You have to report that monthly, and it decreases your SSI payment, because SSI is supposed to be to make sure you can stay alive and have food and shelter, right? And if you have work, you don't need it as much. But here's the thing, they want you to work. They know it's better for your kids to work. So they make it so it's not a dollar for dollar decrease. It is, in fact, first of all, the first $20 in cash they get from any source isn't counted. So you can go ahead and give your kids a $20, not counted. If you work, the next $65 are not counted. No decrease in your SSI payment that month. After that, 50%, okay? So if you make $1,000, let's say you make $1,085 that month. Take off the first 20, take off the next 65, now you're down to 1,000, 50% of that is decreased. You're going to 50% less, or $500 less in your SSI payment that month.
So
it decreases your SSI for that month.
Just
that month, yeah. Now, watch out with a $2,000 asset limit. They're not kidding about that. The second you're over, it stops. So you need to make sure that that money's spent, put into a special needs account, put into an ABLE account once we have them available, which I think will be end of the year or next year. Let me just explain what an ABLE account is. It's like a college savings, just enacted in Congress in December. You're able to use it and not count against SSI. Only $14,000 per year can be put into an ABLE account, okay? So it's not going to be working for everything you need. It's not. You're still going to need a special needs trust for a lot of things, but it will help with these spend down issues, and it's tax-free. Okay, forget that. Okay, Mass Health, like I said, automatic if you get SSI. It's a really good, and you're going to hear a lot more about this from Laura, who's our insurance expert. The one thing I want to mention about Mass Health that's interesting is there's no asset limitation for the kind of Mass Health we want, which is Mass Health Standard. You don't have to worry about that $2,000. You do have an income limitation. Okay, here's a cool program. If you have Mass Health and your kid is 26 or less, and you're paying for their insurance, what we do is we have insurance from my husband's company, and then Mass Health is sort of like the excess insurer if we ever needed it. You get that premium paid for by Mass Health. My husband's premium could be paid for under the Premium Assistance Program by Mass Health. I mention it because it's valuable. It's not just your kid's share of the premium, it's your entire family's share, and nobody knows about it. So, cool program out there. Okay, now we're going to get to SSDI, which is what we just mentioned. And I think I already said, it's also run by Social Security. It can be more money, and it's an insurance program. It's based on what you paid in. Okay, so I want to skip to this working thing. What is an interesting thing is if your kid or you can work when you're young. Look at this. Normally you have to have 40 credits in order to qualify for SSDI, which takes 10 years. Okay, 20 of which have to be earned in the last 10 years. That's the normal standard, all right? It's different if your kid is young or you are young. Before age 24, you can qualify with only 6 credits. Okay, so we have plenty of people that are able to work enough to get 6 credits before 24 that are disabled. And then you say, well, why bother qualifying for SSDI? There's not going to be very much money in the benefit, because after 2 years of being on SSDI, you get Medicare. 24 months, 2 years, you get Medicare. So now your kid has Medicare. All right, so it's worth thinking about. If your kid is able to work or you are able to work, it's worth putting in for SSDI. Otherwise, most of us, such as myself, we're going to use our own, right? When we retire or die, my son will be able to get SSDI. It's easier that way, but... Okay, Section 8 is another good program. You probably all know about it a little bit. Section 8 is the federal program. There are also some state programs. Basically, what Section 8 does is it pays 2/3 of your rent. You only have to pay 1/3, okay? So this is not an asset. They don't care if you have 2,000 or more, but they do care about your income. It has to be low. And it's based on the federal poverty level and what percent, 133% of the federal poverty level. Low income. So what's really great is the portable voucher, okay? There's also vouchers that are project-based that are based on the building, right? And you go live in that building, you're under Section 8, and if you move out of the building, you're not. What's great is the portable voucher, which you get wherever you can find a good apartment, and the landlord collects 2/3 of the rent from the government, the federal government. You pay 1/3 of the rent. And if you want to move, you still got that voucher. You can go somewhere else. It's fabulous. And not only can you move within Massachusetts, you can move in the country. You can move to Rhode Island. You can move to California. You still have your voucher. So why doesn't everybody have one? Because there's a huge waiting list. I advise you all to get on the waiting list. I don't care if you think your kid's going to qualify. Put your name on the waiting list. It takes about right now 10 years to get that portable voucher. You're much more likely to get it in your own town. The towns want to give it to their own people. So, but you want to put it on the mass. Here's the list that covers all there's like 4 or 5 different lists. You want to put it on the clearinghouse list that covers them all, so that in case somebody else comes up and gives you the voucher. Food stamps is another good program. It's both asset-based and income-based. You have to have very little money to get food stamps. My plan is if my son gets into a group home, we'll be able to use the food stamps to help with that cost. There's also energy utility assistance programs out there. Okay, so now I'm going to talk about, now you understand why you might need a supplemental needs trust in your will, because of that $2,000 asset limit. So let's talk about what those can do for you. There are actually, I was going to say there are these types of, the regular third-party supplemental needs trust is the one I was talking about, that it's paid for, the money comes from somebody other than you. So it's generally your parents, your grandparents, or somebody. So there's no payback provision for mass health in a regular third-party special needs trust. There are other types of special needs trusts if your kid or you, disabled, have money yourself. Often, like if it's a litigation, so that's a settlement, or somebody accidentally lets you inherit, or you make money. If it's your money and you want to shelter it from the $2,000 asset limitation for SSI, you need to put it into what we call a D4A trust. And the reason we call that's a statute that allows this not to be counted. And there's the quid pro quo of that is that any money left in that trust goes to pay back Mass Health for anything you spent, okay? So that does not apply to your regular third party, in other words, someone else's money's trust. They don't have to pay it back. That can go to your other siblings or whatever. But for a D4A, when it's your own money, why would the government allow you not to count that? It's your own money. You should be counting that. Well, you put it into a trust, and you're going to pay back Mass Health when you die. If there's any money left, you can let other people inherit it, like your siblings or your whatever. But first is Mass Health. If you don't have that provision, it doesn't work, and money's going to be counted. So it's important to put that provision in as your own money. Okay, there are very specific ways you have to create that D4A trust, which again is your own money. It's a funding provision. You can't create it yourself. It has to be created by a parent, grandparent, guardian, or court. So we actually have a bill in Congress now to try to change that because we think that's kind of crazy. Why can't a disabled person create it themselves? Honestly, I think it might be like a drafting error. It doesn't make any sense. But while that's happening, we are creating D4A trusts for all our clients and putting $10 in and just having it in case they ever need one and there's nobody there to create it because it's hard for the court to create it. So we just do that. Hopefully soon enough we won't have to do that anymore. And as I mentioned, there's this payback provision, which is again, the death event, the trustee has to reimburse the Mass Health for anything paid by any state. Also, there are pool trusts. I don't know if you've heard about these. This is run by nonprofits. The Jewish Children and Family Services has one. The Berkshire Arc has one. Also, we use the state plan of Massachusetts and Rhode Island. So those are the 3 plans we tend to use. They are just like a D4A. They're your own money. The reason that people like to use these pool trusts is they're a little bit easier for smaller amounts. You don't have to create a big trust. You just give it to the pool trust, and they take care of it. A lot less handling. You're not going to have somebody watching out as it calling you, seeing how you're doing with a trustee. It's a service they provide, and they write the checks, and they take a bit of the money afterwards. And first Mass Health gets paid, then they get paid. There's probably not going to be any money left, but generally we advise if you don't have a whole lot of money, but you need to put it somewhere. The ABLE Act isn't in effect yet. And it's your money, think about one of these pooled trusts. How do you fund the special needs trust in your will? That you want to make sure your loved one has something left. So people often want to use life insurance. It's a handy way to, in my case, we did a second to die policy. So that means it's cheaper. And once both of us are dead, my son Billy gets all of that money. We put the whole premium into that special needs trust. So we have 2 other kids. He gets the whole value of the life insurance. So that just makes us feel better. We know there's going to be a decent amount of money there. How much money is, depends. Try to see how things are going. How much money you think they're going to need, We don't know yet with our kid. I mean, we know that he needs money, but we don't know if maybe he'll someday get funding for a group home or something like that. But right now he needs, money. So do the best you can. If you can afford the premium, I think that's a great way to go. So there are plenty of people, financial planners that specialize in this kind of thing, helping you figure out what you're going to have left, how are you going to fund this, do you need a life insurance policy, should it be a second to die? Be careful about thinking about your retirement plan going to fund your child, because it's very tricky. They have the mandatory distribution requirements once you hit 70 and a half. So it's hard, because then if they have to distribute to your kid, now he doesn't have SSI anymore because he's got money. Or if you want to put it into a trust, you have to make sure the trust is written right so it's not considered. You have to have a life that they can calculate from, how long the distribution is going to go on. So this, again, I could go on for an hour on that issue, but just be careful about your retirement plans and thinking about using all that for anybody that's inheriting. Got to be careful, but especially special needs person. So for what can the special needs trustee you pay for? Okay, and this applies to both the third party and the D4A trust. Anything. They can use it for anything. We write them. They have complete discretion to do whatever they want. Now, some people write them differently, and they say they cannot use it for food and shelter. Why do they do that? Because they want to protect their SSI benefit. We don't put that in because if they want to use it for food and shelter and lose SSI because they have enough money that they want to live nicely and not worry about that, they should be able to do that. So they need to be sophisticated enough to understand that when they're paying extra rent or food or whatever, that their payments are going to go down in SSI, but they're making the decision to do that. So it can be used for anything. Just don't give them any cash. Don't give them more than $20. Don't give them a debit card. Pay their vendors. Pay their rent. Not their rent, unless you want to. But pay their Netflix bill. Don't give it to them to pay. They cannot have cash, or it's counted against them. Oh, and I want to make this point. There's a cap on how much your SSI payment will decrease if you pay for food or shelter. 1/3 of the payment, which is $260. So I could pay my son $2,000 a month for a beautiful penthouse, let's say $10,000 a month. His SSI would only decrease by $260 a month. This is why a trustee might choose to go ahead and pay some rent, because they're just taking that hit in the SSI, but it's not going to completely go away. Important to select the right trustee, especially when you're gone. You're not, hopefully you can have somebody. We like it when you have somebody in your family. That's the best. Well, for the guardian. Your trustee, you want to have somebody that's sophisticated with money and knows enough to hire somebody to do the money part if they don't want to do it themselves. So we often have the same person be the guardian and the trustee, but that's fine as long as they're good at both and they know to hire somebody if there's a decent amount of money to help them manage it. But we often might want to have the guardian be somebody in the family and the trustee be an institution, so that you have a little bit of check and balance. Another idea is to have a family situation where you want your husband and family be involved and your family be involved. You can have one of them be the guardian and one of them be the trustee. You just have to make sure you trust them and that their values are your values the best you can. And look, this is a big issue for a lot of people. They don't have somebody that they really feel that way about. So we do have some professional guardians we can recommend. Corporate guardianship program in Lexington, I think, is very good. So, talk to us and we'll come up with some ideas for you. But it's important. It's probably one of the most important things you're going to do, right? Okay, so as a trustee, these are traps for the unwary. Don't give them more than $20 in cash. Don't commingle their funds with yours. You have to make sure you don't have any savings bonds. Keep records of what you're doing. For SSI, you have to keep them informed. If you have a job, like I said, you have to report monthly if you have a job on your income. There's an app to do that within the first 6 days of the month. But if you change your jobs, you have to tell them. If you move, you have to tell them. There's things you have to tell them or you lose your benefits, so just be on it. Okay, now we're on to the ABLE account. So the ABLE Act was passed here in Massachusetts in July of last year. We passed it before the federal government did, even though it doesn't do any good until the federal government agrees that we can save taxes. We couldn't establish it until the federal government did it, but the federal government, when it came through in December, Obama signed it in December, it's Achieving a Better Life Experience. That's what it stands for. So I don't know how many of you guys know about 529 plans for college, but this is a 529A plan for our disabled kids. It's only fair. We're going to save for our typical kids. We also get to save for our disabled kids tax-free. So there's some real problems with it, unfortunately. You can only put up to $14,000, which sounds like a lot of money, but if you're trying to use it for a trust, it isn't a lot of money. So it's a tool you can use, but it's not going to work for all purposes. And again, it's not effective yet, but we expect it to be effective by the end of the year, maybe. The IRS still hasn't issued its regulations for it, but they just issued guidance saying, go ahead, states, and set one up, and we will catch up. We will honor, we'll fix whatever you did, so don't wait on us. So it could be by the end of the year. Massachusetts is on this, so it'll be run by like a Fidelity or something, just think like a 529. And the beautiful thing is the first $100,000 in that account is not countable towards SSI. So you can contribute more than that. If it grows to more than 100, you don't get SSI until you spend it down. So you can't ever have more than 100,000 in it. You can't have more than one account. So if your grandma in Michigan sets up an account for you, that's it. Or if they pay 10,000, you could pay 4,000. Various people can pay into it, including yourself. If you're working, you can use this as a way to not go over that $2,000 asset limit, and save it here. And it's tax-free. Post-tax money goes into the ABLE account. So you've been taxed on it, but then it grows and comes out tax-free. There are limitations on how you can use the money, so it's not everything. It's kind of broad. It's education, housing, transportation, personal support services, dental. Dental is not covered by Mass Health. Dental's a big one, right? Doesn't say that here, but that's my interpretation of health. Oversight and monitoring, my interpretation is staff. You could pay for staff with it. So we don't have the regs yet. We don't know exactly what all this is going to mean, but we think that that's probably what's going to happen. This is Mass Health payback, just like a D4A. Whatever you put in there, when you or your son or child dies, Mass Health gets whatever they put into it. Okay, so that's a reason towards, even though it's tax-free and growing tax-free, you kind of want to keep using it. You don't want to just sit there forever. So here's what it's going to be used for. Not a checking account. I can't use it in and out because it's, it's very cumbersome. Oh, and they say you can use it for housing, but if you use it for housing, it's going to decrease your SSI, except 1/3, and then there's that cap. So here's the reasons why I think the ABLE account is great. It's great to spend down your assets before you apply to SSI. Put it in an ABLE account. Now you don't have it. Make sure you have no more than $2,000 when you apply. Convenient way for grandparents. Sometimes grandparents want to, for tax estate purposes, they want to give $14,000 a year, which they can give the state tax-free to each child. Now that child can get something too. It used to be that they couldn't do that for them unless they created a special needs trust, which they can certainly do, and they might want to do because of the Mass Health payback provision. Okay. And it's a good way for those who are on SSDI to save taxes, right? Because they don't have the Mass Health payback since they're not, assuming they didn't get services from Mass Health. Okay, so guardianship and conservatorship. Guardianship, we just had a new, complete revamping of our system in Massachusetts in 2009. So now we have two different things. Guardianship is for the person, conservatorship is for the money. So in a lot of my cases, we do not bother with the conservatorship because they don't have any money. So it's just the guardianship is the issue. And when they the person turns 18, if they are not competent, they don't have capacity, they need to get a guardian, and you have to go to court to do that. It's a bit of a process because we want to make sure we're not you're taking away that person's rights, and we want to make sure we're doing it right. And we also want to make the guardianship as limited as possible now. So we have this Schedule A we attach that lists all the things that they can do that we're not trying to be guardianship for. Now this applies only to people that lack capacity to make their own decisions. So in a lot of your cases, I think that will not be the case. They will have capacity. So in those cases, I recommend that you do a power of attorney and a healthcare proxy. It's it accomplishes a lot of the same things. It lets them keep making their own decisions about their lives and where they live, where they go to school, and all those kind of things. But yet, it gives you the power to help with them with their assets, power of attorney, and with their health with a healthcare proxy. So that might be a better way. I recommend that every single person in this room have one, because if you become incapacitated mentally and you don't have one, then it's a big deal for your spouse or whoever to go to court and get the guardianship. It's a pain. Whereas you just sign this piece of paper, done. So I think everybody should have one, but that's another way to convince your loved one, you need to do this, we're all doing it. So if you do need to go to guardianship, you need a medical certificate by a registered physician to show they need to have the guardianship. Has to be, the petition now asks for reasons that the guardianship should not be limited. And then I put in the handout the steps to getting guardianship. You certainly can do it yourself. All the forms are online. So it's a bit of a pain, and if it's at all contested, I don't recommend it. Also, if you need a Rogers guardianship, and a Rogers guardianship is when you're taking antipsychotic medication. That's there's a bunch of more hoops to have to jump through, because we don't want to start thinking that some of our people are being, overly medicated and left in the corner, not bothering anybody by this kind of medication. So we take a lot of care. In Rogers guardianships, you have to do an annual report by the physician on how the medication's going and the dosage and all that. And you have to have a special certificate from the prescribed physician when you apply. So it's a bit harder. But anyway, the forms are all online if you want to do it yourself. Or you can call us for consultation and try to make it happen yourself if it's uncontested and fairly simple. So the guardian has total control over the ordinary personal decisions of the incapacitated person. So where they go to school, where they live, what they do. And I talk about the Rogers as extraordinary medical care. Well, we're an elder firm, so if you need to put somebody in a nursing home, you have to go to court. There's some things that require above and beyond, even though you're guardian, above and beyond for the court involvement. Well, those are the medical responsibilities. Court requires an annual guardianship report. I've noticed courts lately have been waiving that if you're the parent that clearly, but I don't want to speak for all judges. Some judges don't. And here are the alternatives. Variable power of attorney, representative payee, that's for your Social Security income. If you want to be in charge of Social Security income, you can file to be a representative payee. And trust we've talked about, healthcare proxies. Okay, that's it. So it's quick. So we have some time for questions. Yes? No? Okay. If you are a person's guardian, are you responsible for their financial debts? No, you're not. So guardian is only guardianship of the person. The conservator takes care of their money. So the conservator would be responsible, but they would have complete control over the money. So that shouldn't be, But no, guardianship, you do have to file a bond Don't get excited, it's not a big deal. It's usually sureties or waived, you don't have to pay anything, but they do require a bond. Mainly, it says so that they can sue you, it gives you jurisdiction, but they do not, there's nothing that says you're responsible for their debts. In order to be eligible for an ABLE account, you have to be determined to be disabled before you're age 26. So that's, in our view, well, okay, the Congress, we wanted this ABLE account to be up to 100,000 or more, and not the 14,000 limitation, and apply to everybody, not just age 26. And Congress has this new thing where they have to pay for everything as they go. They determined the ABLE Act would cost our government $19 billion. They just added those two limitations. It can only be 14,000 a year total, and you have to be disabled by the time you're 26, and it came down to $2 billion. So that's what happened. It's unfortunate. So how do you determine if somebody's disabled before they're 26? The regs, yeah, go ahead. Okay, the question is, there's a fast track to get SSI or SSDI?
Yeah.
I do not know about that. What I do know is that when you apply and this is really when you turn 18. If you apply when you turn 18 and a half, but you were eligible by 18, they give you back payment. So that's not a fast track, but it's a back payment. Okay, but if you're in dire straits and need the money immediately, I don't know about that. Okay, good question. So the question is, if you already have a special needs non-payback trust, and by that we mean a third-party trust created by the parent or somebody other than a disabled person, is there any reason to do an ABLE Act? Okay, so the reasons to do an ABLE Act, I don't know if you care about the tax savings, because it's not going to be that significant, and you're going to have the Medicaid payback. In my view, it's up to you. It's another thing, it's another account to have. If your kid is, one reason you might think about it is the child can control it. You don't have a trustee that controls it. So it gives them a way to have their own money. Okay, they can decide what to do to spend it. So if you're in a position where your person is sort of getting used to money and wants to learn, maybe an ABLE Act, because they can control it. But other than that, is it worth it for the tax savings? I don't think so, because of the mass health payback provision. But it's up to you. You might think it is for, it's another tool. My husband kind of wants to do one. I'm like, oh, whatever. So I don't know. For convenience for me, no, because I'd rather just keep my money, right? And give it to my kid as he needs it for myself. But if you want to train your child to use their own money and not get over that $2,000 limit, it's a good way to do it. And the main reason would be the tax savings and the increased their earnings. In this environment, you're not going to get much tax savings because we're not having, the interest rates are so low. But it'll be something. So I tell you, a lot of people are asking that question. They're like, they come to these seminars just on the ABLE Act to hear all about it, and they go away in a huff, like, this isn't really going to help me, because they expected more, unfortunately. But it is a tool in certain circumstances. Okay, so representative pay is one thing and one thing only. You take their SSI benefit. That's all it is. The SSI, you don't have to go to court. SSI, you have to go to SSI with your documentation that you are the appropriate person to be the payee. And you take care of their SSI benefit. Then you have to file a report every year, by the way, on how you spent the money. Only because they want to make sure you spend it on that person and not on you, okay? They don't care if they're not picky about how you spend the money as long as it's on that person. So conservatorship is every bit of their money. So you need a conservatorship if the person has money, okay? So it's not likely to be somebody that has SSI. And somebody that has SSI doesn't have more than 2,000 in assets, normally doesn't need a conservatorship. Pool trust is not tax-free at all. It's asking about pool trust. Pool trust is something where you put money in, it's your own money, it's not the parent's money, and you want to keep it away from SSI, so you make that 2,000 asset limit, and somebody else takes care of managing it. You don't have to worry about investing it and how you're investing it, and someone else takes care of paying it out. They have forms, and you fill out a form, you want something to be paid, and they'll pay it for you, but it's not tax-free. Yeah, they want a certain chunk before they'll open it for you, but it's not too big. I was thinking Berkshire ARC is like $2,500. And then would have to talk to them about how often they're willing to accept regular payments into it. Yes. I don't know that you're going to need a conservatorship if you have a special needs trust with a trustee that will take care of that. I don't think you have to go through the problem of getting a conservatorship. So your real question is, do you want the trustee to be the same person as the representative payee? My answer is yes. But you don't have to do anything now. Tell your trustee, hey, when this all happens, apply to SS, the Social Security Administration, to be the representative payee when I'm gone. Yes. Please cross out the mass resources. I'm sorry that I didn't get to that before I sent this. They stopped their website March 1, which was a really great website, right? They're done. They probably didn't get the funding, I don't know. You try to go there, you'll not get anything. Massresources.org is a great website, a great help for us. So now you have to go to Google it and find it. So the list, though, that I gave you will work.
Which list?
The masslist.org. If one is to create a special needs trust, do they need to have a formal designation of disabled? No. We tell our clients, we don't care if they're fine. If you have any thoughts about it, go ahead and set this up. It will not hurt them. It will only help them. The trustee has complete discretion on what to do. So your kid grows up to be a fabulous provider, kids, everything. He's got a special needs trust. The trustee will just give him the money. He can do whatever he wants. It doesn't hurt to have it. But if he does need it, the trustee will see that he needs it and will be able to operate accordingly.
So
Okay,
what's
please,
the advantage
if you
to
have
that?
a trust set up already and it wasn't a special needs trust, please review the trust document and make sure it is very clear that the person, the beneficiary, is not entitled to any money at any time, 25, 30, any time. It's completely up to the trustee. Then it will pass. That's all you really needed to say. We often put in, this is to supplement but not supplant government benefits, to make it really clear, which is better. But if you want to come to me, I'll fix it and make it better. But it will work if it's 100% up to the discretion at all times of the trustee, whether they get paid or not. Then it's not considered your daughter's money. It's considered, yeah. All right. Okay. Is there any chance you can get Section 8 voucher back if you've lost it? What I've been told is no, you have to start all over, 10 years. So what I would do is look at Mass Rehab and other sources to get her situated in the meantime, because I don't think you're going to get that back. I don't think you can go to the front of the line once you've lost it. Thank you very much.
Thank you very much.
Please call me or email me if you have questions.